A macular hole is a tiny gap in the center of the retina, and it blurs the sharpest part of your sight. The macula is the tiny central patch of retina you use to read, drive, and recognize faces in fine detail. Most macular holes form as the vitreous gel inside the eye shrinks with age and tugs on the delicate central retina. People often notice a dark or blurred spot in the middle of vision, wavy lines, or missing letters when reading. Doctors confirm the hole using an OCT scan, which shows the retinal layers in a detailed cross-section image. Surgery is usually recommended because full-thickness holes rarely close on their own and tend to grow larger over time. The surgeon removes the vitreous gel through tiny ports, releasing the pulling forces on the central retina. Next, a very thin membrane on the retina's surface is peeled to release tension and help the hole close. Finally, the eye is filled with a gas bubble that gently presses the edges of the hole together while it heals. Because the bubble floats upward, many patients spend several days with their head tilted face down, so it presses on the macula. The gas bubble slowly absorbs on its own over 2 to 8 weeks, and vision gradually returns as it shrinks. Air travel and high altitude must be avoided until the bubble has fully absorbed, as pressure can rise dangerously. Modern surgery closes the hole in the great majority of cases, and most people regain useful central vision over months. Risks are uncommon, but include raised eye pressure, cataract formation, retinal detachment, and rarely, infection inside the eye. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.